Now to a CBS 11 News investigation tonight concerning some very important recalls, but these are not recalls for cars, food, electronics. They're for people's bodies.
Specifically, parts put into patients' bodies during surgery. CBS 11 investigator Ginger Allen is here. So, Ginger, this isn't something top of mind, really. When you have surgery, you expect whatever they put in you to work.
You do expect it. But our investigation raises questions about everything from a hip implant to a heart valve to contact lens. The Food and Drug Administration fast-tracks certain medical devices so they end up on the market and in people without testing. And now a North Texas woman says this may have caused her and thousands of other patients severe pain.
At one time, nothing seemed too challenging for Dee Dee Hill Morgan. The retired probation officer from Fort Worth stayed right in step with her grandchildren.
I was a more active grandmother.
Now, she doesn't even know what tomorrow will bring. Doctors tell her she is poisoned.
It's frightening, and it's like a helpless feeling.
She says chromium and cobalt leaked into her bloodstream after she had both hips replaced. In March of 2009, she received her first implant, and the following March, doctors replaced her other hip.
March has not been a good month for me.
Then came the bouts of pain, blurred vision, and nausea.
It would be almost like a metal taste, and it would be almost kind of like an upset stomach.
What Morgan did not know was the maker of her implants, DePuy Orthopedics, a subsidiary of Johnson & Johnson, had voluntarily recalled the very same implant in Australia, and the recall happened 4 months before Morgan had her second hip implant here in the U.S.
If DePuy had merely withdrawn this product from the market in the United States in December of 2009, at the same time they withdrew it from the Australian market, then Dee Dee would not have had a second hip implant.
Attorney Dan McDonald says patients in other parts of the world had been complaining of component loosening, metal sensitivity, and pain. In short, metal grinding on metal, sending particles of cobalt and chromium into their bloodstreams.
Why in the world would they have left this product on the market in the United States when they had made a decision to withdraw it from the Australian market in December of 2009?
Attorneys all over the country are now filing lawsuits for patients who have had or still have to have total hip replacements again. But whether you've had a hip implant or a heart valve, there's a bigger picture here. These lawsuits are all exposing how some medical devices are getting to the market in the first place.
The FDA has what's called the 510K rule. It allows some medical products to go straight to the market without ever being tested. All the manufacturer has to do is prove the device is substantially equivalent to another one the FDA has already deemed safe and effective. The FDA gave the DePuy hip replacement, or ASR, clearance because the manufacturer said it was similar to this hip implant, one that doctors now say has not had the same problems.
So this is how the cup fits into the pelvis.
Dr. Jay Mabry is the chief of orthopedics at Baylor University Medical Center.
Should the DePuy ASR ever have made it to the market?
No, that was not the right thing to do, and it should never have come before the U.S. market.
The Institute of Medicine is now asking the FDA to scrap the 510K medical device clearance process and to make sure it requires more testing of products like the DePuy hip implant, defibrillators, hospital pumps, all of the medical devices that qualify for this fast-track pass.
The 510K process is flawed, and I think the Institute of Medicine was right to say it needs to be changed. To what degree? I don't know. But it does need to be changed.
Any change comes too late for Dee Dee Hill Morgan.
So I don't know what the long-term effects are.
Now, she's just focused on her health and her future.
You don't have control over your own life because that part was snatched away.
Dee Dee Morgan Hill's case is one of about 2,000 now headed to court. DePuy did send us a statement saying it is committed to working with patients to address medical costs directly associated with the recall. That includes copays, deductible expenses, lost wages, and travel costs. Now, it also confirmed for me that this hip system was cleared for marketing by that 510K regulatory process, which is used for a majority of medical devices on the market, according to their statement.
So obviously at one point Congress did approve this rule. So what is the advantage of getting some of these things to market more quickly?
I've read a lot about the other side of this, and what they say is some of these device makers argue that some product changes are just so subtle that the patient should not have to wait the normal 5 to 10 year process, which is how long it can take to see them approved. The FDA does tell me it is now considering some feedback on this issue. There's actually an open forum on their website website, and that's where I read a lot about the other side. We've linked that open form to our website as well.
Well, it's hard to think body part recall in the
Yeah.
same sentence.
Interesting story,
And then
Ginger.
imagine having to go through it.
Yeah.
Crazy.
Thank you, Ginger. Great story.